what are the, all of us over 50 have those moments.
Yep.
But what can we really say with what we know at this moment in time are the combinatorial early signs that we really need to tune into?
Sure. So I think people have to be thinking about this, because if people are proactive and they learn about their own brain health and their own risk, they can make brain healthy choices over the life course to reduce that risk quite significantly. 4 out of every 10 cases of dementia may be preventable. Probably closer to 5 or 6, but the data hasn't strictly proven that yet. And 46 million Americans currently have Alzheimer's disease pathology, the bad stuff, the proteins, building up in their brains but no symptoms yet. 46 million Americans. So what can people do? First, take a deep breath, because I think a lot of people say, oh, do I have Alzheimer's? I missed a word or I missed something. We live in a tough society. We have bad news coming at you 24/7 on the phones. We have distraction constantly. People that can't pay attention can't remember things. So I think there's a lot of miscommunication, misconceptions about missing something or a word being on the tip of your tongue and remembering it later, and that's not necessarily Alzheimer's disease, and that could be other things. So the first thing I would say is knowledge is power. If you miss a word, or if you're concerned, of course talk to your doctor. There are several risk factors, medical risk factors, that can be controlled by any primary care physician. High blood pressure, high cholesterol, high blood sugar, diabetes, lack of exercise, poor eating habits, lack of sleep, too much stress. These are all things that can advance brain aging, impact cognitive function, but also increase a person's risk for Alzheimer's and other neurodegenerative diseases. So I guess what I would say is, if someone's over 50, or even over 30 or 40, or 60 or 70, because at any age someone can make a brain healthy choice to improve their risk, I think take a deep breath, get educated, get informed, and talk to a doctor.
Great. So you just touched on a couple of these things, but I would say, as everybody's favorite neuroscientist in my community, the number one question I get asked is, what can I do now as a mom of teens in my 40s and 50s to stop myself from developing Alzheimer's? And you touched on some of this, but what would you say would be like the top 3 or 4 things?
So I'm glad you asked this question, because it's among the most common questions I get, and it's also very on point, because 2 out of every 3 brains affected by Alzheimer's are women's brains. We used to say, we don't know why. Sex-specific features or this or that or whatever. Well, there's a big factor, and it's that during the perimenopause transition, there's a rapid decline of estrogen. And in certain women with certain genes, one gene is called the ApoE4 variant, some of the work that we've done and others suggests that if you can really kind of smooth out that rapid drop of estrogen in certain women who are predisposed to Alzheimer's, especially with that gene, you can kind of really forestall, potentially, cognitive decline, the buildup of bad plaques, amyloid plaques, and maybe even really delay the disease by quite a significant period of time. And I think using hormone replacement therapy has been controversial. Some of the studies in the past kind of had some confusing results, and I think when you relook at the data, maybe that wasn't the case, but using hormone replacement early in the perimenopause transition for whether it's 5, 7, 8, 9, or 10 years, we still have to figure out the sweet spot. But what I say is, for women, talk about the perimenopause transition and see a doctor. I guess the other things I would say is, there's not really a perfect one-size-fits-all approach. I wish there was. Great cocktail party question. If I have to answer quickly, exercise on a regular basis, eating a brain-healthy diet, Mediterranean style for sure, getting adequate sleep, like tracking your sleep and making sleep a priority, mitigating stress, and then a really important part of medical practice that really should not be overlooked is maintaining and modifying and really being aggressive about vascular risk factors. High blood pressure, high cholesterol, diabetes, fast forwards cognitive decline related to Alzheimer's and that bad pathology. So the real answer is precision medicine, where we do genetic tests, we do deep dive laboratory tests, and unfortunately that's expensive. It's not really practiced commonly throughout the United States, but I think the future is precision medicine, and our goal is to generalize this, and we've been working pretty hard on a study that's launching very soon called yourbrainstudy.org, and it's an NIH-funded study where we can democratize this type of care, and anyone with a cell phone can actually go on, get a risk assessment, take cognitive tests, and the software will guide the person through a brain healthy lifestyle change and monitor trajectory over time. So that's really where we try to go.
So you just touched on the women-men difference. Given all the understood changes that you just came up with, do we have magic formula right now using genomics, proteomics, biometrics, whatever, to be able to say, here is the group of women in their 40s who are becoming perimenopausal, who are higher at risk or not? Or how close are we to that?
I'm going to have a better answer soon.
Okay.
But for the first time, literally just a few weeks ago, so very recent stuff, fresh off the press, and don't even have the pre-post results yet back. We have a woman who's 40-something years old, just starting to undergo the perimenopause transition. The estrogen just dropped. She's having some night sweats, but she's in her mid-40s. So what are we doing? We're going to test the markers in the blood, amyloid protein, tau protein, other new emerging markers, NFL, GFAP, a lot of gobbledygook. But we can now characterize brain pathology by looking at the blood. And not just by looking at the blood in the vein, we're trying to move towards a finger prick test.
Great.
So this woman we gave cards to, never done this before, she comes into the office, we take the blood, she gets a prescription for the estrogen replacement, she's going to use a patch, she's going to use progesterone for about 2 weeks at the end of her cycle. This was in collaboration with an OBGYN that has a lot of experience. And then at 2 weeks and at 4 weeks, she has the finger prick cards. She's actually in Europe this week, and she pricked, and she sends the cards back. And then 2 weeks later, she pricks and sends a card back. Terrific. And that way, in real time, we can assess these things, because right now we don't have the full picture.
Right. The natural response of anybody who's a little bit worried is to Google it, right? You hop on the internet, you begin to look for what is known, what isn't known, are the tests I can take to see how old my brain really is. We've known for a long time that the whole idea of looking at somebody's internet use and their wearables and monitoring biometrics in different ways is going to tell us about their lifestyle, their cognitive capacity, their social capacity. But where are we right now with respect to incorporating those kind of elements into a better understanding of where somebody is and how they're progressing?
So in 2017, we did the first wearable study for kind of cognitive prevention and cognitive tracking. And it was a wearable where they wore on their wrist, and we followed people basically 24/7. We had a little dashboard. I was a coach. I got this access to my team, and we tracked this for the first time. What we showed in a very early study is that the lifestyle choices a person made that we were able to verify in real time, exercise patterns and sleep, correlated with cognitive function the next day. Does that mean it's preventing Alzheimer's? I'm not exactly sure, but that was kind of the first proof of concept. We use wearables. We use glucose monitors that you can put a little sensor on the skin. We use phone-based assessments, so in real time, just-in-time testing. And I think that has to be the future. I think in some ways, how does someone swipe a phone? How do their eye movements move? There's going to be automated tools to detect these things years, if not decades, before symptoms begin. So I think we can use technology to help understand things in a deeper, more granular way. But I don't know that this stuff, there's a lot of nuance here, so I'm not sure the stuff is exactly ready for prime time today, but we're getting close. I guess the other thing I would say is, the future of Alzheimer's prevention, Parkinson's prevention, dementia prevention has really kind of become more clear because of the biomarkers that we can now assess in the blood. And when we partner pathologic factors that can be done on a simple blood test, just like we have cholesterol tests where we look at LDL and HDL, the good, the bad cholesterol, things like that. We're going to have very soon a cholesterol test for the brain, colloquially speaking, where we can use these markers. We can assess a person's behavior and lifestyle choices. We can check out when the person just started a new drug for X condition, it had this effect on the pathology of Alzheimer's. And I think that's the perfect marriage of technology, science, and moving medicine forward.
Excellent. So at a conference like this, where we are bringing together the people who are the clinical people and the research people and the tech people and the whole body mindfulness people, there's obviously a lot of talk about really pushing things as fast and as hard as we can. Are you at all concerned about the proliferation of apps to help you with this, and this that are relatively untested across a number of different communities?
Yeah. So,
do we need to let people know to be careful?
Yeah, so the path that we've taken is the very rigorous, very challenging, and regulatorily complex.
Great.
Because what we're trying to do is we're trying to study software, digital therapeutic software, in a real clinical trial,
Right.
a randomized clinical trial, a trial that basically adheres to the FDA CFR 2111, blah blah blah, all the stuff, and we plan to actually do it's a funded grant, and we do the randomized trial, and then we could evaluate effectiveness in a more gold standard way.
Great.
I think when people take surveys pre and post, a survey, 50% of people improve, that's one thing.
Right.
But I think digital therapeutics and other technologies that are new and whatever, apps are everywhere.
Right.
But well-studied, clinically validated software solutions aren't yet.
Rarer. So, leading on from that, you're at a conference like this. You've got great colleagues where you work right now. You meet more people here. What is your dream of the path to the precision medicine option, where everybody is better understood, stratified, well validated? What would your dream be 5 years from now, coming from interacting with people at a place like BrainMind?
Sure. So it's going to be less than 5 years, which is pretty cool and reassuring.
Okay, I was trying to be conservative.
Yeah, I really believe that. But tomorrow I'm going to Fremont, California, which isn't too far from here, and we're going to be purchasing the most expensive equipment purchase I've ever made. Never wired this type of money before, but now we currently track 6 markers of pathology in a blood sample. This new instrument is going to allow us to track 120 different markers, so we can get even more granular. I think the other kind of thing that maybe we do need 5 years for is to have automated tools to better understand a person's whole genome sequence.
Right.
Currently, it is a massive millions and millions of genetic parts that we have to try to decode, and we do this by hand right now. It's a very inefficient system. So I think when we have automated tools to interpret genetics, we have these machines that can massively scale the amount of markers that we can assess from pre to post and longitudinally over time. I think I'm pretty excited about that, whether that's 1, 2, 3, 4, or 5 years.
Right.
It's coming, but the technology is here. It's not anymore like a pie in the sky thing where we need a new invention or a new something. The technology is here, and now we have to harness it.
And bring in some informed data scientists to help us bring it all together into one wonderful equation of where you are on your hopefully preventative dementia Parkinson's journey.
You need a team, a multidisciplinary team, because I'm a clinician by heart. I'm okay at the science, but I'm not an expert in the basic science. We need neurochemists, we need ethicists, we need all sorts of people in the middle. We need data scientists, statisticians, we need basic scientists. So we need a team, and I think that's the beauty of events like this. So my favorite part of BrainMind was meeting people from all walks of life in different fields of science and entrepreneurship and technology. And you just have conversations that don't really happen everywhere else. I've met people from different continents, different states, different walks of life, different focuses in their professional careers. And it's this ecosystem that really fast forwards science.